I just want to make sure, can you see the slides, Kristen? Yep,
Yeah.
okay, perfect. So thanks for the introduction, Kristen. My name is Veronica. I'm one of the physiotherapists at Blueberry Therapy, and really excited to talk to you guys today about exercise. Not so much about the importance of exercise, because I'm sure we're all pretty familiar with that now, but really the harder part is actually getting exercise in. So hopefully we'll go through some strategies today to start to light that fire within you to build exercise more into your day. And we know it's not easy to fit exercise in. Sometimes might be easier than others. It's really common when making any sort of behavior change to do really well for some time and then to relapse, and then to go back to doing really well and then relapsing. And it's okay to go through this cycle. So some of these phrases might sound familiar. I've certainly heard this from other clients, from friends, even maybe even from myself. You know, I want to exercise more, but I don't know how I'm going to fit it in. I did really well for 2 weeks and then fell off the wagon. I've heard people say there's no point going to physio since I haven't been doing my exercises. Or the last point, which I have found myself saying, is, you know, I was really great at exercising regularly before the pandemic, but now it's so much harder with everything closed. And it is a lot harder with everything closed. I think it's good to acknowledge that. Yeah, and it's okay. We understand it. It's not easy to build exercise into your day sometimes, even with the physio exercises. And so if you're working with a physio, whether it's, you know, having trouble getting your physio exercises in or getting in some sort of regular physical activity, I believe that it's part of our role, our job as physios to work with you to problem solve around this. That said, I have 5 steps today that I'll take you all through to help you get started on lighting the fire within yourself to build exercise into your day a little bit more. So the 5 steps: step 1, be kind to yourself. Step 2, figure out what's your why. Step 3, what gets in the way and what can you do about it. Step 4, set a short-term SMART goal. And step 5, quick tricks that you can do right now to increase your chances of success. And again, these steps apply whether it's for general physical activity exercises, or maybe it's your specific exercises that you've been prescribed by your physio that you're having trouble fitting it in. All right, so step 1, be kind to yourself. I think that if we all spoke to our friends the way we spoke to ourselves, we probably wouldn't have many friends left. We really tend to be our own worst critics. And what research has found is that when you show compassion to yourself, so when you support yourself and you're kind to yourself, especially in the face of stress or failure, such as failing to achieve whatever exercise goal that you've set, self-compassion is actually a much more effective motivator than self-criticism. Sometimes we might worry, oh, if I'm not critical of myself, I'm not going to keep striving to do better, but that's actually not true. When you are kind to yourself, failure is a lot easier to take because you have that kindness to support you. And it helps you achieve that growth mindset. You're more okay with learning from your failures to figure out what you're going to do differently next time, because we know that failure is a part of life. So if you're having trouble figuring out, okay, how do I actually be kind to myself? Think of what would you say to a friend and who's struggling in a similar situation. And sometimes I find that's really helpful. Think of how you would talk to a friend. Step 2, what's your why? So we know exercise is important. There's a lot of benefits to exercise, but figuring sort of deep down why exercise is actually important to you in your life can be really helpful, especially in those moments when you just don't feel like exercising, or maybe you don't enjoy the burning in your muscles, or feeling really out of breath when you're exercising. Maybe you don't enjoy those sensations. So knowing deep down what's your why you're putting yourself through this besides, you know, exercise being healthy, can be really an important process of maintaining that motivation to keep doing it. So I'll review quickly some of the benefits of exercise if you haven't heard already. Scientists are always looking for miracle cures for things. And it turns out we do have a miracle cure. Unfortunately, it's not actually in this physical pill form, but physical activity and exercise does wonders for us cognitively, emotionally, and physically. We know that long-term regular exercise decreases pain and disability. It reduces the risk and progression of dementia and Alzheimer's, and of diabetes. It reduces your risk of falls and fractures, which, a fall and fracture may or may not seem like much, but when you're 60, 70, 80 years old and you have a fall, you break your hip, that can be a major change in your quality of life and mobility. Regular exercise can decrease anxiety, depression. It actually reduces your overall risk of death, reduces fatigue in the long term, improves your quality of life, and there's probably many other benefits here. And of course, the exercise that we prescribe in physio, it's meant to improve your symptoms as well. But these, so symptom improvement, the physical, cognitive, and emotional benefits, these are like superficial reasons for why to exercise. I think it's important to dig deep down to think about what's important to you. So maybe it's being there for your family and friends, maybe certain leisure recreational activities, maybe your work. It's important to you. Maybe taking care of your physical health is important to you. And thinking about how exercise is actually relevant to these deeper values can be an important part of building exercise into your routine. So what do I mean by this? So let's go with general exercise. And let's say spending time with your grandkids or your kids is important to you. And so how might exercising regularly be relevant to that? Well, maybe you notice that when you're active, you're more mobile, and it's easier for you to keep up with your grandkids or your kids when they're running around. It's easier for you to get up on and off the ground and to play with them. Maybe your work is important to you, and you know that when you exercise regularly, you can handle stress better and you can think more clearly when you're at work, make better decisions. Maybe just taking care of your body is something that's important to you. So knowing that regular exercise is one of the ways of working towards that value of taking care of your body. Let's talk a bit about your physio exercises. So your physio exercises, they've been prescribed presumably to improve whatever symptoms you're going to see physio for. So again, symptom improvement is one thing, but how is that actually relevant to your life? Why is it important to your life? Maybe if you, again, enjoy spending time with your kids or grandkids, if your issue is around urgency and needing to go to the bathroom often, maybe if you didn't have to go to the bathroom quite as often, you felt more confident controlling that urge, you might feel more confident going out on longer outings to the park, which you know that your kids or grandkids really love. Maybe leisure recreation, maybe running is really important to you. And if you had less leaking, you might be able to run more. Maybe taking care of your body is important to you. So in that case, recognizing that your pelvic floor is a part of your body. And so if you really value taking care of your body, taking care of your pelvic floor is an important part of that. So these are all just examples, but it can be really helpful to take some time to figure out, okay, what is it that's important to me? How do I want to live my life? And how does exercising regularly help me move towards that? All right, so step 3, what gets in the way and what can I do about it? And this step is one that people don't often think of when it comes to goal setting, is actually taking this time to think about those barriers that might come up and what you can do about it, and sort of brainstorming around these barriers before these barriers come up so that you have strategies in place. I know I'm going to do this if this barrier comes up. I know I'm going to do this if this barrier comes up. So some common barriers. Not enough time, too tired, maybe at the end of the day after work, you just want to kick your feet up on the couch and you don't want to put on your jacket, maybe your boots if it's winter time, and go for a walk. maybe you forget. Sometimes I hear that a lot from clients, especially for physio-specific exercises. Sometimes it can be easy to forget if it's not a part of your routine yet. Maybe it feels too overwhelming, and sometimes that can lead to procrastination, putting it off. Maybe it's too boring. It's not very fun for you. Maybe there's some guilt. So guilt from taking time away from family or work to be able to do this exercise. Sometimes pain can be an issue. Weather, such as snow in April, who would expect that? And cost. And there's probably other barriers too that I haven't thought of here, but certainly these are a lot of the common barriers that I've heard about. So what can you do about it? Well, I'm going to speak first to weather and cost. Like weather, if you have a goal that is weather dependent, thinking about a backup plan for your goal. Maybe it's that you're going to have a rain jacket so that you walk no matter what outside. Unfortunately, with malls being closed now, it's not like you can go for a walk in the mall at this time. But if weather is going to be an issue, can you come up with a backup plan for your goal? Cost. Sometimes cost can be a barrier, and there's also a lot of free activities as well that you can do. So going for a walk is free. There's lots of YouTube videos online if you have access to internet. And I think with COVID now, there just seems to be a lot more options that are a lot more cost friendly for sure. All right, now I'll go into other strategies, but really it works best if you come up with the strategies yourself, because really you know your life the best, and you know yourself the best and what's actually going to work for you. And yeah, so what research has found is that if you're able to come up with your own, what you perceive are your barriers and what strategies you think might work for you, that's actually what's going to work best, rather than me giving you these different ideas. That said, I'll offer some different suggestions for you now, and if any of them really resonate with you, feel free to run with these ideas. So first one, pairing it with an existing habit. This can be especially helpful if you tend to forget to do it, or if it's sort of an overwhelming thing. Can you do a little bit with something that you already do? So maybe if you brush your teeth twice a day, can that be the time when you do your Kegels? You do your Kegels right after you brush your teeth. Or maybe if it's general exercise, can you do 10 calf raises every time you brush your teeth? Or can you do 20 jumping jacks? Or maybe whenever you're waiting for the coffee to brew, you're doing some squats. And so when you pair it with something that you already do on a regular basis, that increases the likelihood that you'll actually do it.
Veronica?
Yep.
Is there anything to be said, like, should you do exercise? This is a question from in the morning or in the evening, or is there a time of day that you should do the exercise?
Is this about like exercise in general, or like the physio-specific exercises?
The question was, does it matter what time of day to exercise, even if it's right before going to bed?
Yeah, so I guess if it's like higher intensity exercise, that might make it a little bit harder to fall asleep. That said, you can still, there's no harm in doing that. You can give that a try, and if that works for you and it's not affecting your sleep, then feel free to fit that in at that point. Yeah, it's probably the high intensity exercise at the end of the day that's probably would be most problematic. Not that it's bad for you, but it could affect your sleep a little bit, your ability to fall asleep, just because you're getting your nervous system a little bit more excited with some high intensity exercise. But if it's more low or moderate intensity exercise, maybe like, for example, if you're doing a little yoga routine, or some light strengthening exercises, that's probably okay at the end of the day as well. Sometimes doing it right after a meal can be helpful as well, or maybe like 10 minutes after a meal, to help with managing the blood glucose level changes that happen after a meal as well. Good question. All right. So Next tip is, so if you find it to be really overwhelming or time intensive or painful, is there a way that you can break up what you're doing? Can you modify the exercise in some way so that it's not so overwhelming, so that it doesn't take up so much time? Do you have to build all these tall Lego towers at once, or can you build smaller ones? Can you take your time with building them, maybe putting one block at a time rather than doing 10 blocks at a time? It's okay to start small. And if you're not sure how to modify your exercises, you can always reach out to your physio to ask for different variations, because there's always ways to modify your exercises. If you find it really boring, make it fun. Obviously, COVID certainly limits the more fun options that are out there, but is there a way to make it fun, given what we have? So if you like dancing or you like music, can you put on a song that you like and dance to it for that song, or one or two songs? Can you do some sort of virtual hangout with a friend, so it's a little bit social and you guys are doing a workout video, like following the same workout video at the same time, so you're sort of getting that social aspect of it, and it's still COVID safe, and you're getting the exercise component. Maybe you guys get to chat afterwards for 20-30 minutes to again get that social, more fun aspect of it. And maybe even can you treat yourself in some way? Can you use some sort of reward to make it tip the scale so that you're more likely to do exercise? I know at least there's been more than a handful of times where the one thing that got me to go to the gym was knowing that afterwards I would get to go to Starbucks after and get myself a small drink. So obviously I know that I'm very privileged to be able to do that, but it doesn't have to be food related, and you want it to be within your means. So maybe you let yourself, watch a show that you enjoy afterwards, doing something that you enjoy afterwards, treat yourself. Or maybe even during. Yesterday, I really didn't feel like exercising yesterday. I had planned like 6 minutes of kettlebell swings, like 20 seconds on, 10 seconds off. So 6 minutes is not, it's not a long time, and yet I just didn't want to do it. And the thing that helped to tip the scales for me was letting myself watch an episode of Superstore on Netflix. So a funny show that I like on Netflix while I was doing the kettlebell swings, and that's the one thing that helped me tip the scales to actually do the exercise. So figure out a way to make it fun for yourself, and maybe treat yourself too, if that's what's going to help you do it.
Veronica, I'm so glad you put this in, because I think this piece is so important. And I listened to a podcast today, and the woman does all kinds of psychology research on grit and those people that kind of stick it out. And she was talking particularly about going into an exercise and the different mindset between, I should do a workout, which, you kind of drag your heels to go into, or I really like to do that. So I mean, just changing your mindset, changing your phrasing. She said what they found was the people that, tried to frame things in a way that felt more fun actually worked out harder. They had better outcomes than like, I know I should do this, so I'm just gonna do it. Right? So that fun element is important.
So spinning it more positively, I'm sure it does something to your brain too, and changes the brain is wired and how it thinks about exercise. Thanks for sharing, Kristen.
No problem.
So if you tend to forget, can you set a phone reminder? And you put up sticky notes somewhere where you will see it, and remember to do it. Ideally, maybe in the location where you had planned to do the exercise. We talked about pairing it with an existing habit. You already do that habit anyway, so if you pair it, you're more likely to do it. You have an accountability partner, someone who's gonna follow up with you, or maybe you ask them to remind you to do the exercise, and we'll talk a little bit more about that later. Can you build it into your daily activities? So what I mean by this is, so exercise and physical activity are slightly different things. Exercise is a type of physical activity. Exercise is like a session where you're, the purpose of it is really improving your fitness, whereas physical activity is sort of any sort of movement, which can include exercise as well. So building it into your daily activities is increasing physical activity levels in some way. So this comic, the Heart and Brain comic by the Awkward Yeti, I really like his comics. He does a lot of great stuff. In this comic, you know, the lungs are like, I see a light. Should I go to the light? I'm going to the light. Give this note to my mother. And the brain is like, we haven't even started exercising yet. Well, the heart is like, yeah, but we parked pretty far away. And while this is a joke, parking further away is actually a great way to just get a few more steps in than you would normally. If you're going grocery shopping, that means you're also carrying your groceries for further. So if there's a way that you can build it into your daily activity so it's more sustainable, it's not like this extra thing that you have to do, that's great to get those 10,000 steps in. Some other ideas, you know, can you walk to the grocery store instead of driving there? Can you split your laundry load, say, into 2 smaller loads? You have to take the stairs twice if you know your laundry's in the basement. And then if you're feeling guilty, or maybe you just aren't feeling like it, first of all, remind yourself of your why. So we know that exercise is important, but why is it relevant to those things that are actually important to you? And then kindly give yourself permission to take care of yourself, just to take care of yourself, especially if you're feeling guilty about, say, taking time away from your kid or from spending time with family. Know that it's okay to take care of yourself and to put on your oxygen mask first. And if there is guilt about taking time away from your family, can you involve your family some way so that it's sort of like this fun family activity that you're doing, and that way your kids are getting more, your kids or partner are becoming more active too. Benefits for everyone. And then can you mindfully choose to do it anyway because of your why, even though you know your mind is telling you that you don't want to. So remembering that you are the driver of your own bus, not your thoughts. You know, not your thoughts, your feelings, your urges here. Your mind might be saying, oh, it'd be so much easier to just watch TV. You really don't feel like it today. You still need to do the dishes. Your mind can be saying all these things, and you know, you as a driver of the bus might say, you know, I'm going to exercise because it's important to me. Or you might reframe it so that it's a little bit more fun. I'm going to exercise because you know this is fun. If it is fun, because I feel better afterwards. And this is, of course, a lot easier said than done. This is a skill it takes practice to do, and sometimes it's going to be easier than others to do this, to allow those thoughts and urges to be there and to still go ahead and do whatever it is that you plan to do because it's important to you. All right, so step 4, setting a short-term SMART goal. So a SMART goal, for those of you who haven't heard of it before, SMART is an acronym. It stands for specific. So what are you going to do? Where are you going to do it? When you're going to do it? Measurable. How long you do it, or how many repetitions and sets. Achievable. Is this doable for you right now, knowing your life and other responsibilities? Are you setting, you know, too big of a goal for yourself that's realistic for you? Is this actually doable for you right now? Reminding yourself why it's relevant to you. And then the last is timely. So how long is this goal going to last for? When are you going to follow up with yourself next? And when are you going to start? So let's go through an example here. So in this top goal, I will walk more for the next 2 weeks. Admirable, wanting to walk more. They've got the time component here for the next 2 weeks. But but what does more actually mean? How do you know when you've actually walked more? Is it one step more? Is it 2 steps more? How do you know when you've achieved more, right? So in the second goal here is I will walk for 10 minutes a day on Monday, Wednesday, Friday after dinner around my neighborhood for the next 2 weeks starting this Friday. So that second goal, much more SMART specific. You know exactly how long you're aiming to walk for, so you know when you've achieved the goal or not. We also know that when you set a specific time to do it, you're much less likely to put it off, because it's really easy to say later, or it's really easy to say, I'm going to start tomorrow. So when you set this specific time and dates for yourself, but when you're going to start, that increases the likelihood that you're going to do it. All right, so I'm going to give you guys some time right now to set a short-term SMART goal for yourself. Ideally, if you can find a piece of pen and paper to write it down, that would be best. Or if you're on a computer, you can type it out as well. I'm just going to give you guys a couple of minutes to do this. I'm going to do this myself because I've been struggling with exercising regularly. All right, and we're going to talk about why writing down is important soon. Hopefully everyone has something written down now. So now that you've written down a goal, thinking about how confident am I that I can achieve this goal that I set? So being honest with yourself. If you were to think of a traffic light, green, yellow, red, how confident are you feeling? Is it green, you're very confident you can do it? Is it more yellow, red, you think you can do it, but you're not quite sure, you're feeling a little bit unsure? If it's green, go for it, that's great. If it's yellow or red, what can you modify about your goal to make it a green? And ideally, you'd want it to be so easy that you're like, of course I can do that. Like that, obviously I can do that. Like that's how easy you want it to be. Really give your permission to start small, because it's those small goals, those small successes that build on itself. When you set a small goal, you know, you're more likely to achieve it. And then when you achieve it, you get that dopamine hit from your brain. And so you feel really good about achieving it. And then you're more likely to set another goal, and that builds, that sort of snowballs. So as an example, a friend of mine, she has been struggling with exercising regularly with COVID. She had been working on her push-ups for a while, but then that sort of fell off. And so lately she'd been wanting to start it again. And she decided to make a goal of just starting with 5 knee push-ups per day, which when we were chatting about it, she felt that 5 knee push-ups a day, that's probably not really going to do much in terms of her progressing her push-ups. And at the same time, if she were to set a bigger goal, it would be almost too overwhelming for her, and it'd be just too big of a barrier for her to do, and she would end up doing 0 knee push-ups a day. So she decided to go with 5 because that's what she felt was realistic and not overwhelming for her. And since then, so it's been a couple weeks since she set that, she's done at least 5 knee push-ups a day. Sometimes she ends up doing multiple sets per day. Sometimes she ends up doing more than 5 in a row, but she gets at least 5 in. And so that's the neat thing with starting small is sometimes at starting it's the hardest part. But when you give yourself this small goal to start off with, that can really set you up for success. So then once you've set your goal, maybe revisiting step 3, thinking about, is there anything that might get in the way? So if there's a weather component, you can think of some sort of backup plan for that. If you feel like you might forget, how are you going to remind yourself, thinking of those things to get around the barriers that could come up. And then last step, so step 5, some quick tricks from research to increase your chances of success. So this was a research study done by Dr. Gail Matthews. She's a clinical psychologist from the Dominican University of California. And in this research study, they recruited 149 people for all different walks of life to take part in this goal setting study. And what they did is they asked these people about what goals they would like to accomplish over the next 4 weeks. And then they divided them up into 5 different groups. So in the first group, they didn't write down their goals. They just thought about what they would like to do. In the second group, they wrote down their goals. In the third group, they wrote down their goals and actually came up with some action steps that were relevant to the goals. In the fourth group, they wrote down their goals, came up with these action steps, and they told a friend about their goals and action steps. And then the fifth group, they did all of that, whatever the group 4 did, and they sent weekly progress reports to a friend. And I think this study is really neat because, so then at the end of the 4 weeks, they asked them how they did with their goals. And what they found is that the group that just wrote down their goals, nothing else, they wrote down their goals, they were 42% more successful than the people who didn't write down their goals. And the people who wrote down their goals came up with these action steps, and they told a friend about it, and they sent weekly progress reports to a friend. They were 77% more successful than the group who just thought of the goals and they didn't write anything down. Now, obviously, there's probably a bit of a selection bias because people who sign up for a study on setting goals are probably a little bit more motivated than people who don't sign up for this sort of study. But it's sort of neat that even among these people who already have some level of motivation, there's these strategies that can help them to improve how successful they are. So my takeaways, my quick tricks and tips to increase your chances of success. 1, if you only do the first one, that in itself is going to boost your chances of success by 42%. Write your goal down. So if you haven't done this already, please get a piece of pen and paper, write it down, or do it immediately after you're done this webinar. 2, tell a supportive friend about your goal and any applicable action steps. So an action step might be like if your goal was around wanting to do an exercise video, maybe ahead of time you might choose which video you're going to do so that on the day that you actually set to do your video, you're not spending half an hour trying to figure out which video you want to do. And thirdly, if you can, send your friend weekly progress reports if they're up for that, obviously with their permission. And so at your weekly check-ins, whether that's with your friend or maybe with yourself, thinking about, did you accomplish your exercise goal? If yes, pat yourself on the back. You did it. Are you going to continue with the same exercises, or are you going to make some sort of changes to the exercises to progress it in some way? And you don't always have to make changes if that's working well for you for your goal. You don't feel like you need to keep doing more and more each week. If you haven't accomplished your exercise goal in that past week, that's okay. Be kind to yourself. Take this as a learning opportunity. It's not always easy. Think about what got in the way and what can you do differently next time to increase your chances of success. All right. So to summarize what we chatted about today, know that you are not alone in terms of making exercise a more regular routine. It can be hard to do, and you might have done really well for years, and then this pandemic hit and everything was thrown off, and these setbacks are normal, and that's okay. That's sort of part of life. But that doesn't mean you just give up entirely. You can keep working on it. So the steps to do that, one is be kind to yourself. What would you say to a friend? Step two, dig deep to figure out, okay, what's your why for doing this? Why are you putting yourself through the sweat and the burning muscles and the burning in your lungs? Step three, thinking about what gets in the way specifically to you, and then what's a strategy that you think would be helpful to get around that barrier. We talked about some different strategies. Really, that step three works the best if you make it really specific to your situation. Step four, set a short-term SMART goal. Hopefully you guys all have a SMART goal now that you're gonna work on. And then step five, we talked about these quick tricks to increase your chances of success. That was writing your goals down, telling a friend about it, both of which you can do today, and then sending weekly progress reports to a friend. And so lastly, if you're having trouble after this, feel free to reach out. So this video, we're here to work with you to do the things that are important to you, not to lecture or judge you. We're human too, and we struggle with this as well. If not with this, certainly with other behavior changes, I'm sure we all go through these struggles, and we can troubleshoot with you if you're having difficulty. All right, so I've chatted, I've said a lot of things. What questions are there?
Veronica, that was awesome. I think you know me, I'm an avid exerciser, but each time we've had a lockdown, I have found that I'm a little slower to get going. And I just actually writing that goal down made me go, oh, yes, I can do this. This is what I have to do. But those tips are so good. And I actually have a neighbor who's amazing that we set kind of like times to walk and all that kind of stuff. That's a pretty neat study that shows, like, if you write it down, you tell somebody, and then you report back to somebody, your chances are that much better.
It's just very simple things that is surprising how big of a difference that it can make.
Yeah, for sure. Yeah, I actually, mine is just a comment more than it is a question, but great reminders all the way along there.
Yeah, exercising during COVID is not easy. I would say I've been pretty consistently exercising since like my second year in undergrad, which I don't know how, a number of years now. And since the pandemic, it's been a lot more hit and miss. Like good for a couple months, and then it peters off, and it's just a lot harder. There's a lot less options out there. So, and that's part of dealing with the pandemic. I have to keep trying.
Do you find, so Veronica, you work at Blueberry, but you also work with clients who have more kind of pain at McMaster? Do you find that there are different type of strategies for a client like that, or you just kind of incorporate all of these for both clients?
Yeah, actually, it's pretty much the same strategies. I guess we tend to break it up a lot more. So like pairing it with an existing habit so that they're not quite doing as much exercise, but like doing maybe a little less more frequently throughout the day, just because they're more likely to flare up if they do too much. But yeah, I'm running a group right now. So it's, I work with people who have persistent pain, and one patient, she'd been having trouble fitting exercises in, and what she found most helpful for her was just setting a goal of just starting with some simple neck stretches that we were doing in class, just like some neck movements while she's waiting for her water to boil in the morning before she unloads the dishwasher. And she finds that once she gets going with those small movements, just little movements that she can just do them sitting down, she's more likely to continue with all the other exercises, even though that's not her initial plan. Her initial plan is just to do these 2 or 3 little things she's just sitting in a chair. She doesn't have to move too much because she feels really stiff in the morning. If she just does those 2 things, she can do the rest of it. Because yeah, sometimes it's the getting started that can be really hard. If it's overwhelming, it seems like too much. Just make it go smaller. Like my friend who just did the 5 push-ups, the 5 knee push-ups to start off with.
Yeah.
Yeah, so a lot of the strategies are the same. It's really just modifying it and being okay with starting small, giving yourself permission to just start small.
Yeah, and what about, there's just a comment about a suggestion and about visual reward charts like we do with kids, something like that as a opportunity to keep us on track.
Yeah. If that works for you, yeah, I'd certainly give it a try, especially if that works for you. I know that's worked for me in the past, at least in the short term, and that might be something that, at least keeps you going for a few weeks, if not longer. Yeah, definitely give that a try.
That on this podcast, they were talking about that tonight too, like things that are in your field of vision are things that you're going to read more, see more. So those are where you're going to put your goals. Those are where you're going to put the foods that you want to eat. And you're going to, they made the example of you're going to put the Halloween candy in the freezer, but the bananas and the apples on the counter.
Right.
Just to, tip the scales in your favor.
Yeah.
So I keep my, since I'm working out at home right now, I keep my weights right in front of my couch. So sometimes like I'll even be watching a show, I'll just pick them up and kind of play around with them.
Yeah, it's the same reason I have my kettlebell like in my living room, which is close to my back patio or back door. So like when my toddler wants to go out to play in the backyard, play with water, sometimes it's easy for me to grab that kettlebell and just do something out there. Again, something is better than nothing. Even if it's not structured, something is better than nothing.
That's great. So some great takeaways about how to be kind to yourself, how to set some goals, how to write them down, how to break things into little chunks, and then to reflect back. And that's the other thing is, if you haven't met a goal, not just to make a new goal, but think about what are the reasons why you weren't able to meet it. And that's a learning opportunity too, right? With grace, with kindness to yourself,
Yeah, I think that's really important. And that's the nice thing about that self-compassion piece. It's easier to reflect on your failure and to see what can be learned from it.
Awesome. Do people on the call have any other questions? Either you want to put it into the chat or come off mute. All right. Really well done, and some great new information. Thank you so much, Veronica, and thank you those that were able to join tonight. We will post this up on our Blueberry Therapy YouTube channel if you are interested or want to hear it again or want to indicate to some friends that it's up there. So thank you. Really.
Yeah, thanks for listening and for joining us today. And thanks, Kristen, for hosting this all.
No problem. I'll see you in a few weeks. In a few weeks, actually, those are on the call if you're interested. We are having a couple of things happen in May. Let me just get the actual list for you, as well as a couple in June. I have these all set up. So just a moment and I'll find. So in Wednesday, May 5th, so just in 2 weeks, we have one of our speech language pathologists, Rebecca, is going to come and talk about a parent's guide to sight words. That one's a little bit later just because she has some young kids at home. So it'll be Wednesday, May 5th, 8:30 to 9:30. And then the following, or 2 weeks after that, Thursday, so that one is the only Thursday, May 20th from 8 to 9, Laura Doyle, she's a physio and also a certified lactation consultant, is going to talk about breastfeeding basics. And then into June 2nd, Meg Solomons and myself are going to talk about endometriosis. And then Wednesday, June 16th, I'm going to talk about how to rid yourself of pelvic pain. In 1 hour, you're going to learn it all. Veronica's laughing because she knows that's not true, but some good tips and tools anyway. So if people are interested, there's more coming up, and that can be found anywhere on our social media, on our website, in our newsletters, and or you can just contact us. So have a good night, everybody.
Bye, everyone.